What causes mixed dementia in patients? Have you ever wondered what causes mixed dementia in patients? Mixed dementia is a complex condition where a person shows signs of more than one type of dementia at the same time. The most common combination is Alzheimer's disease and vascular dementia. To understand mixed dementia, we need to look at the factors from both types of dementia involved. Alzheimer's disease is the leading cause of dementia. It is marked by the buildup of abnormal proteins in the brain, such as amyloid plaques and tau tangles. These changes damage brain cells and disrupt cognitive function. Several factors influence the development of Alzheimer's, including age, genetics, chronic inflammation, cardiovascular health, lifestyle choices, and environmental factors. On the other hand, vascular dementia occurs due to damage to blood vessels that reduces blood flow to the brain. Conditions like high blood pressure, diabetes, and smoking can lead to this damage. When blood flow is impaired, brain cells can die from a lack of oxygen and nutrients. Mixed dementia happens when the changes associated with Alzheimer's coexist with vascular injuries in the brain, resulting in overlapping symptoms. Several key risk factors contribute to the development of mixed dementia. Age is the most significant factor, as the risk of both Alzheimer's and vascular changes increases with advancing age. Cardiovascular and metabolic health also play a role. High blood pressure, diabetes, and smoking are major risk factors that can increase the likelihood of developing dementia. These factors can work together, raising the risk even more than they would individually. Genetics can influence the likelihood of developing both Alzheimer's and vascular dementia. Lifestyle and environmental factors, such as chronic stress, poor diet, lack of physical activity, exposure to air pollution and toxins, may also heighten the risk of neurodegeneration and vascular damage. Additionally, a history of traumatic brain injury can raise the risk of developing mixed dementia. In mixed dementia, the brain exhibits both the protein abnormalities typical of Alzheimer's disease and the vascular lesions from impaired blood flow. This vascular damage can worsen the effects of Alzheimer's pathology by reducing the brain's ability to recover and adapt. Chronic inflammation and oxidative stress from vascular issues can further speed up neurodegeneration. Environmental factors, like poor urban design and limited green spaces, may also negatively impact cognitive health. Mixed dementia often presents with more severe and complex cognitive symptoms than either Alzheimer's or vascular dementia alone. Diagnosing mixed dementia can be challenging due to overlapping symptoms. It often requires careful clinical evaluation and sometimes brain imaging or biomarker testing. Managing mixed dementia involves addressing both the neurodegenerative and vascular aspects. This includes controlling cardiovascular risk factors like blood pressure and blood sugar, along with providing supportive care for cognitive symptoms. In summary, mixed dementia arises from the combination of Alzheimer's disease pathology and vascular brain injuries, influenced by aging, genetics, cardiovascular health, lifestyle, and environmental factors. Effective prevention and management focus on maintaining vascular health and slowing cognitive decline.